Good morning or good afternoon, depending on the time zone that you're in right now. And welcome to the third workshop in the Pathways to Prosperity 2026 virtual workshop series, which takes place on a Tuesday at 1 p.m. each month. Now, I am now going to turn things over to Carolyn Amonte and Natalia Brown, who are from the P2P Standing Committee on Immigration to Small, Medium, and Remote Communities for this exciting workshop entitled The Impact of Changes to Settlement Service Eligibility on Newcomers in Small, Medium, and Remote Communities. So over to you.
Hey, thank you, Vicki. So good morning or good afternoon, everyone. My name is Natalia Brown, and I'm the chair of P2P's Standing Committee for Immigration to Small, Medium, and Remote Communities, and a professor of economics at Nipissing University in Ontario. I'm joined in the moderator role by Carolyn Amantea, Regional Program Manager of Settlement and Language Services at the Columbia Basin Alliance for Literacy in British Columbia. Before we begin, I would like to acknowledge that I am joining you from Nipissing University, which sits on the land that is Nipissing First Nations traditional territory and a traditional territory of the Anishinaabe, lands protected by the Robinson-Huron Treaty of 1850. I would also like to acknowledge the neighboring communities of Tamagami First Nation and Dokis First Nation. As we're meeting virtually from many different locations, I encourage everyone to reflect on the lands on which you reside and the Indigenous peoples whose traditional territory they may be. We acknowledge their enduring relationship with the land and reaffirm our commitment to reconciliation, respect, and meaningful partnership. So for today's topic, looking at the impact of changes to settlement service eligibility on newcomers in small, medium, and remote communities, we're really grateful to have our wonderful speakers on the panel and their willingness to share their time, knowledge, and expertise with us. The speakers will discuss the impact of changes to eligibility for IRCC-funded services in the context of broader changes in the sector, as well as strategies that service providers in small, medium, and remote communities are using to mitigate or respond to these changes. So I'm going to turn it over to Carolyn to introduce our speakers.
Thank you, Natalia, and thank you everybody for joining us, and thank you to our wonderful speakers. Joining us today, we have Adam Amza, Program Coordinator of the Lanark and Renfrew Immigrant Settlement Services, where he oversees newcomer settlement and settlement workers in schools programs serving rural communities across Eastern Ontario. With extensive experience in immigrant and refugee settlement, community partnerships, and service coordination, Adam works closely with local organizations to strengthen newcomer integration, improve access to services, and support community capacity building in rural and small town settings. We're also joined by Sasha Logan, Executive Director of Skeena Diversity Society in Terrace, British Columbia, located on the traditional territory of the Tsimshian people. Involved with the organization since its inception in 2000, she has helped guide its growth into a hub for newcomer settlement and community inclusion in Northwest BC. She played a key role in establishing the Greater Terrace Local Immigration Partnership and currently serves as the chair of the City of Terrace Housing Committee. Sasha brings more than 25 years of experience in community development, settlement services, and partnership building. Miriam Gatale is the settlement manager at Portage Learning and Literacy Center, where she oversees a range of newcomer services, including settlement, language programming, and the Resettlement Assistance Program, and the Settlement Workers in Schools program. With over 12 years of experience in the settlement sector, helping newcomers build successful lives in their new communities, Miriam has worked alongside refugees, immigrants, schools, community organizations, and government partners. She has led initiatives focused on trauma-informed practice, cross-cultural understanding, community integration, and building capacity within the settlement sector. Leslie Seidel is a consultant on public policy and governance based in Montreal and a fellow of the Institute for Research on Public Policy and a senior advisor with the Forum of Federations. During his long association with the IRPP, he directed its research programs on immigration, Canadian federalism, and governance. He worked previously for the Government of Canada, including as Director General, Strategic Policy and Research in the Intergovernmental Affairs branch of the Privy Council Office. Leslie has published extensively on migration, constitutional reform, electoral reform, and public management.
Thanks, Carolyn. So first, we're going to invite Leslie to give a short presentation on settlement services in Canada. Then we have some prepared questions for our panelists. After the speakers have responded to our prepared questions, we will take questions from the audience. Please use the chat to submit questions, and that's located at the bottom of your screen. You can type your questions throughout the workshop, as well as react to participants' questions to let us decide which questions are the most popular. So Leslie, I would invite you to speak. You have the floor.
Hello, everyone, and I'm glad that so many people have been able to join us from across the country. Je vais présenter en anglais, mais s'il y a des questions en français après, il me ferait plaisir de répondre dans cette langue. As mentioned, I have quite a long-standing interest in migration issues. Among other things, I coordinated a 7-country project for the Forum of Federations about 15 years ago, and the book was published by McGill Queen's University Press. And I've not only coordinated projects, but written quite extensively on migrant integration services and programs. And today I'm drawing on a report that I did for the Institute for Research on Public Policy, the Center of Excellence on the Canadian Federation, that was published in May, this May. And the study addresses services and programs of the Government of Canada, specifically IRCC, governments of Ontario and BC, and the cities of Toronto and Vancouver. The report includes extensive new research, including data on spending and on client reach, and draws on 8 interviews that I conducted specifically for the project. The details of this publication are given at the end of this PowerPoint, which I believe will be posted online shortly after this workshop. The next slide, please. Although political leaders and experts in other countries would not necessarily agree, I see migrant integration as a public or government responsibility. It is not a one-dimension area. Rather, it has several dimensions: economic, social, civic, and political. And I won't go into them. I explain these in the IRPP report that I just mentioned. What's important about migrant integration is that it involves mutual obligations for migrants and the broader society. At least this is the view that is quite widely accepted in Canada and in, how shall I say, more enlightened circles in other countries. There are, of course, many people who don't believe that the broader society has an obligation, but I don't support that position. And this statement about mutual obligations is virtually word for word the same as Section 3 of the Immigration and Refugees Protection Act of 2001. This is the Canadian statute, of course. Now, Canada has one of the most extensive networks of migrant integration services in the world. Most of these services are funded by governments, but delivered under contract by community organizations, or what are sometimes referred to as service provider organizations. About the only 2 countries that I think might, at least on a spending per person, per migrant basis, compete with Canada would be Germany and Sweden. Germany with its integration course and its in-depth language training, and Sweden also with in-depth language learning that can last up to a year. Now, I can't say that these are more extensive in the sense of the number of people reached, because migration has gone down, particularly in Sweden, which used to take a lot of refugees. But just to take 3 Canadian figures, this is from the settlement program of IRCC from 2023-24. There were 576,842 unique clients who avail themselves of information and orientation services. Following that, as far as the needs assessments and referrals, there were 333,219 unique clients and 121 and 072 unique clients in language training. That's a lot of people who are reached in one way or another by the settlement program. That's not, of course, including the programs of provinces or the programs or initiatives that certain cities have. Most of the cities are, because of jurisdiction and budgets, most of their programs are relatively modest. But nevertheless, they do play an important role. The settlement program of IRCC is targeting almost exclusively permanent residents. There are, however, some limited exceptions. For example, the Ukrainians who have come to Canada under the Canada-Ukraine Authorization for Emergency Travel. Of course, there's also the refugee resettlement program, but the refugees in this case are themselves permanent residents. Larger provinces have programs with broader eligibility criteria, and I go into this in the report that I mentioned. And these the other groups that they serve include refugee claimants, temporary foreign workers. In Quebec, those categories are targeted, as well as quite extensive availability of language training and other services for international students. Next slide, please. Now, the context we're going through is, of course, related quite directly to the drop in the number of permanent residents being admitted to Canada. In the graph, you see the tallest line is tallest bar is in 2024. There were 483,655 permanent residents admitted that year. The declines in permanent residents began in 2025. So that year there were 393,530 permanent residents. The level that has been set, the targeted level for 2026, 7 and 8, that level is 380,000. There are nevertheless going to be additional admissions in 2026, refugee claimants and also temporary workers who will transition into permanent residents. IRCC continues with the reporting and the respect of the annual levels. But as we go forward, if there are categories with really quite large numbers, it might be helpful if the idea of level or target or whatever be more clearly communicated. I'm sure I'll make myself unpopular with some of the participants online, but I say something quite similar in the report. Next slide, please. So just quickly on spending on settlement services for permanent residents and also for refugees. In 2022-23, and this is reflecting still the significant flows through the Roxham Road into Quebec, $461 million on the refugee assistance. The highest spending for the general settlement program was in 2024-25, $1.17 billion that year. And you'll see that the settlement program spending for 2025-26, which isn't yet, there may be final data, but I don't have them, has dropped somewhat. Next slide, please. So the settlement and resettlement program budget for 2026-27 will be $935.7 million. That's a decrease of almost 10% compared to what would have been the budget for that fiscal year if expenditure review hadn't been put in place. There will be further reductions in subsequent fiscal years, and I believe there are discussions underway, perhaps with the organizations represented on our panel, about reduced amounts under the contracts with IRCC. When it comes to other provinces, the grant to Quebec has been and will be remaining stable. One of the conditions of the 1991 Accord is that the amount of the grant can never drop compared to the previous year. So even though Quebec has lowered its immigration numbers, it is still receiving, has been for the last couple of years, $867 million. Ontario government spending on its three main programs has remained quite stable over the last 6-7 years, with some time-limited investments for populations with unique needs. First, the Syrians, and secondly, the Ukrainians. So in 2019-20, Ontario spent $106 million on these three programs, which are described in my report. And then by 2024-25, it was $97 million. So if you were to do the conversion for inflation, there's a sizable drop in the Ontario government spending. In contrast, British Columbia provincial government has increased spending considerably. And one of the major reasons for that was the launch of a new program in 2024 called Safe Haven, which provides specialized services for refugee claimants. And that was $12.2 million in 2024-25, about a third of what British Columbia spent in that year on its integration services. Next slide. So I'll just go through these points for discussion quickly. Obviously, you may well have other things that you want to raise, and that's great. But one of the things that I think is important as we go forward is to think about where sources of funding can be diversified and in some cases increased to compensate for the decrease in the settlement program budget. At least in the next 3-4 years, I don't see annual permanent resident admissions rising, at least the official IRCC level. So the budget of the settlement program is not going to go any higher, and it's going to drop further because of the comprehensive spending review that's now under place. Even if spending the money from IRCC is going to drop, it's still worthwhile thinking whether the criteria for IRCC are too rigid, particularly given the number and needs of vulnerable migrants. In my report, I suggest that IRCC might make the criteria less rigid for refugee claimants as a highly vulnerable population, and open the door to funding organizations that support refugee claimants, providing they can get firm commitments for 50% of their budget to be provided by other governments and or organizations. Now, this may be creative at a time when money is very short, but there's lots of room for good ideas and for adjustment within this broad landscape of integration services. And within this context, is there potential for local community organizations to be more involved? Some of them are already, and if some of them could be, for which client groups? Now, this gets us back to the eligibility, and I'll just pass on that. I just want to close with a result from a very recent big survey conducted by Environics Institute, along with the Bridging Divides research network, which has been funded by SSHRC. The question is the following: whether migrants think they and their family have been made to feel welcome in the past 10 years, and very welcome. 33% of respondents agree with that. 58% agreed with generally welcome. So if you put the two together, I'm just doing the math here quickly, I think it's 91% of immigrants who arrived in the last 10 years say that they are feeling welcome in their local community. That's important. And although you can't attribute the welcome only to integration services, whether it's the federally funded or provincially funded, this finding is relevant. And I think it's very important as we go forward to be mindful, and I'm sure most of the people online are very mindful, that preserving these kinds of benefits from integration services is essential. Canada has come a long way in this area, and the essence, the objectives, and the results need to be preserved for healthy migration and a healthy climate in this area in Canada. Thank you for your attention.
Oh, thank you, Leslie. Thank you for providing an excellent overview of the context in which these changes are taking place and raising some interesting points for discussion. Hopefully, we can address some of these during the general Q&A. And just to answer one of the questions from the chat, yes, there will be a copy of Leslie's presentation provided at the P2P website, as well as the recording of this session. Okay, so now we can move to some prepared questions that we have for our panel. After these, we will take questions from the audience. So remember that you can use the chat to submit questions, and you can react to those to give us an idea if this is a popular question or not. So Carolyn, I believe you have the first question.
I do. So this first question is for Sasha and Adam, and you can just take turns. Well, maybe we'll go with Sasha first this time and Adam second. The first question is that it's been 2 months since the first set of changes to eligibility for settlement services went into effect. How are settlement organizations adapting their programs and priorities in anticipation of reduced funding and shorter eligibility periods?
Okay. Thanks, Carolyn, and good morning and good afternoon to everyone. Yeah, so we are now, since we prepared, we are in the middle of the 4th month of the changes, and we are starting to see some impacts and starting to see the clients that are becoming ineligible. I wouldn't say that there have been. So one of the things that we started doing is hosting orientation and celebration for permanent residents, especially those that become permanent residents recently. We want them to understand that they sort of have to take advantage of, they have a limited time and sort of have to move forward quickly. And then as an organization, we're looking, how are we going to address and deal with clients that are becoming ineligible. We have worked over the years to really become a very open, welcoming, inclusive organization, especially in a small town where we are the only settlement service organization. And it's really, I think, challenging for staff and the organization, as well as it might become challenging for the community if we start picking and choosing who can access services. So as I said, as we all know, it's early days, but sort of just a little bit of the new realities.
Perfect. Thanks, Sasha. Adam?
Thank you. Good morning and good afternoon all. So since the phase for the eligibility change came into effect, our organization we've been actively reassessing the way we design our service delivery. The shortened eligibility period has increased the importance of early intervention and connecting newcomers to essential services or providing essential help as soon as they arrive. NARS, information and orientation, employment services, language, those are the ones we provide along with Swiss. And we are prioritizing to ensure clients receive the most critical supports within the limited eligibility window. We're also strengthening our relationship and partnerships with municipalities, libraries, different schools, healthcare providers, and mainly employment agencies to create more coordinated support system for those clients who are out of the eligibility window. And these partnerships are increasingly important for referring clients who have become ineligible for IRCC-funded services but still require assistance. So in anticipation of reduced funding, we are luckily our funding was not cut significantly, but we're reviewing our program offerings and operational costs as our program delivery was affected, and we're trying to minimize impact on frontline services as well. Thank you.
Perfect. Thank you, Adam. Natalia?
Thanks. Okay, so the next question I have is for Miriam, Adam, and Sasha. What unique challenges do small, medium, remote, and rural communities face in responding to these policy changes compared with, say, larger urban centers? So anyone wants to start first? Maybe Miriam, I'll let you start first.
Sure. So policy changes pose both a challenge and an opportunity for us as settlement organizations in small communities. While larger centers have more services available, sometimes individuals fall through the cracks. In our community, we are often able to see who is not getting the support they need, and organizations come together to problem solve. When immigration policies change and some clients are no longer eligible for our services, we reach out to other organizations in the community to connect them with available supports. Because rural communities often have fewer specialized services, we have built strong relationships across sectors, or we've had to, and we continue to strive to build strong relationships and to work closely with our community partners. Rather than referring someone to another specialized agency, we often collaborate to find creative solutions using the resources that are available. Additionally, we look for other funding sources and programs within our organization to help those gaps whenever possible. When there are policy changes like we have, there are also often funding cuts, as we know we've experienced with this one. And like many rural organizations, we've become a hub to address multiple needs within the community. So our staff wear many hats, as I'm sure many other organizations and small communities have experienced. So when funding reductions result in the loss of even one position, that impact extends across multiple programs and services. In larger centers, there may be other organizations that can absorb some of those services, but in smaller communities, the ripple effect is much greater because there are fewer alternatives. When services are reduced for newcomers, the impact extends beyond individuals themselves. We see it affect the ability to find or maintain employment, which in turn affects local employers and the broader community. Supporting newcomers is not just about helping individuals, it strengthens the entire community.
Thanks, Miriam. Adam, did you want to add to that?
Thank you. So the reality when it comes to newcomer settlement and integration, our reality is very different from large and urban centers. If we look at our context, Lanark and Renfrew counties are together about 10,000 square kilometers, encompassing dozens of municipalities, towns, villages, and rural communities. Unlike urban centers where multiple settlement agencies may operate within a small geographic area, our in our region, we are the only point of access for settlement support. And because of that, one of the main challenges that we face is transportation barriers. It's very significant. Most of our municipalities have little or no public transportation at all. So newcomers who do not own a vehicle often struggle to attain appointments, access employment opportunities, enroll in training opportunities, attain language classes, or connect with healthcare providers. Even when transportation options exist, they may be very expensive, limited in scheduling, or unavailable between two different communities. So as a result, newcomers frequently depend on settlement staff, community volunteers, family members, or costly private transportation options to access essential services. The other challenges that we've been facing is limited staffing capacity. Our rural settlement organizations often operate, especially in our case, with smaller teams covering significantly large service areas, and also different services that we provide. So staff are expected to support clients with wide range of needs, including nurse, employment, school integration, housing navigation, everything we do with a small range of staff, because specialized agencies are limited or non-existent in many rural communities, including ours. Settlement workers often become the primary point of contact for issues that extend beyond traditional settlement services. So this is the other challenge that would create workload on staff and can contribute to burnout, and as well as recruitment challenges and difficulties maintaining service capacity across the large regions. The other challenge we've been facing is complex client needs and service gaps. So many newcomers arriving in our area present with increasingly complex settlement needs, and this may include mental health concerns, trauma histories, family challenges, financial instability, and etc. So unlike urban centers, our community often lack specialized support services, and access to newcomer-focused mental health supports, culturally appropriate counseling, or legal clinics could be a challenge. So for those services that are not available in our area, we've been facing a challenge referring a client to a bigger urban center. So that's another challenge we've been facing. Thank you.
All right. Thanks, Adam. Thank you for sharing that. Sasha, did you want to add to?
Sure, I'll build on what Miriam and Adam already spoke about. I think one of the challenges in a smaller centers is there's not that many options for support. I imagine that in a larger community, sometimes there is larger language and cultural communities that often take on supports or houses of worship. I am concerned, especially about the eligibility limitations, because when people come to a small community where they don't know anybody, and they might have already used up their eligibility time, it it will be difficult for them to settle. So we are looking for other sources of funding, of course, so we can keep our doors open and kind of continue being welcoming and inclusive to all newcomers. As you know, for economic immigrants that come either as international students or temporary foreign workers and have those limitations, it's a very difficult journey. And sometimes when they reach PR, it's a great achievement. They are and they want to take a little bit of a break. And now they have only limited time to sort of move forward and progress. So I think it's a lot of pressure, especially on the families of the primary applicant who, what we have seen, people start a family, they focus on that. And when they come for employment support or education, they might have already run out of their eligibility time. So we see that as also it's not just the impact of one program, but it's the whole organization, because we have built a reputation in the community, which I feel that we have to maintain. That it's a little bit, we are more visible as in a small community, so that comes into consideration. And of course, the anti-immigration sentiments and everything, we sort of have to work harder and not be turning people away. So just something in addition to. Thanks.
Great. Thank you, Sasha. This next question is for both Sasha and Adam again. Secondary migrants often relocate several years after arriving in Canada. And how might the new eligibility rules affect their ability to successfully settle in a new community?
Maybe I'll start, as I already
Sure.
kind of touched on that a little bit.
Yeah.
It's like a different country when you come to a small community from a large community, or even to a different community. So we are concerned about the limited eligibility, and we'll have to figure out other ways but in a way that's not going to stretch us beyond our capacity. But I know it's going to be more challenging as we progress through the new policies. We do have partnerships in the community, but many of our partners are also going through funding cuts. So relying probably on recruiting volunteers, and we are looking at different ways how we can address the new landscape and how to support clients. So rather than turning people away, we are trying to find new creative ways how we can support clients that are coming to the community or have used up their eligibility time.
Thank you, Sasha. Adam, do you have something to add to that?
Yes. So, many newcomers move to different communities years after arriving in Canada, and also that's the experience that we've been seeing here in Lanark and Renfrew. The relocations may be driven by different factors, but the trend, especially from what we've been seeing here, is particularly common among newcomers relocating from urban centers to smaller communities in Ontario to live their life, to start family or to settle there permanently. So while these individuals may have already lived in Canada for several years, like as Sasha said, relocating to a new community often creates a second settlement journey. Every community has different employers, sets of cultures, healthcare systems, and also transportation networks and different other way of living. So as a result, newcomers frequently require like a new settlement support, and we've been helping newcomers who have moved to our area after living in Canada for multiple years as well. Just from our experience in our community, we have worked with numerous newcomer families who had already lived in Canada between 6 to 9 years. But although they had been here for this significant period of time, many still faced substantial challenge with language, employment, and community integrations. Due to that, they couldn't even they had the time, and they were eligible to apply for Canadian citizenship, but because they couldn't meet the language requirement, they couldn't apply for Canadian citizenship. So the potential impacts of the reduced eligibility would definitely will show when it comes to employment and economic challenge, slower integration into labor markets, difficulty understanding our regional employment opportunities as well is a challenge in our area because most of our industries often face a shortage of human power when it comes to hiring, and still this would be another challenge on it. And yeah, that would include limited access to job search assistance, resume support, and employer connections. Language and communication barriers as well, continued challenges with English or French language development, which eventually be a challenge to apply for different things, including citizenship, reduced access to language practice programs, conversation circles, and workplace language supports. So the impact on the receiving communities as well, right? So the consequences extend beyond newcomers themselves. Receiving communities also benefit when settlement services are available to support secondary migrants. Effective settlement services help newcomers become economically active, socially connected, and engaged community members more quickly, so that they become independent. So without these supports, communities may experience slower workforce integration of newcomers. We're already facing reduced newcomer retention in rural and smaller communities, greater pressure on mainstream services that may not have specialized settlement expertise, and also lost opportunities to address labor shortage and strengthen community growth as well. Thank you.
Great. Thank you, Adam and Sasha. And thank you for pointing out the impact beyond just the individuals and their families, but also the community impact as well. So my next question is in line with what we've been already talking about. How can service providers continue to support newcomers who are no longer eligible for federally funded settlement services? Can you give us, are there some examples of innovative partnerships or collaborative approaches that have helped or could help maintain services despite funding pressures? So I'm going to ask Leslie maybe to start, and then maybe Miriam, Adam, and Sasha, you can join in. Leslie, would you like to? Yeah.
Well, I think what can be helpful in this context is trying to draw as fully as possible on provincial government programs in this area. I haven't heard whether Ontario or BC or both may be decreasing their funding as a result of the changes to levels. It's maybe less logical in a way, given that the eligibility is so much broader. However, as most people know, temporary resident admissions are also going down. And in the case of international students, I think are actually exceeding the targets that have been set over the last few years and modified over time. It's, of course, always a political issue, and that may explain why, in the case of Ontario, if you look at the level of funding and not counting inflation, it's more or less level with a bit of up and down to reflect refugee and similar groups. Whereas in the case of British Columbia, with an NDP government, there's been quite a significant rise. If you calculate the amount of money spent by British Columbia and Ontario per provincial resident on migrant integration services, they are now, or at least in the last year for which I had figures, they're almost identical, whereas British Columbia was only about half the Ontario number before the recent increases in funding. Of course, there's no easy answer. I continue to believe, though, and I defer to people who are working in the communities whom I greatly admire. I continue to believe that there is potential within communities for greater financial assistance and in-kind assistance. I think the whole area of migrant integration in Canada, because it has been extensively funded by governments, has maybe been seen as something like a public service. Well, it is and it isn't. It's a largely publicly funded set of services, but the delivery is not by governments, it's not by government officials, it's by community organizations. And so the framework of this area already reflects something that is different from government services. I don't know, however, whether the degree of community commitment and involvement reflects the conceptualization that I'm describing. I'll just say that I think there is untapped potential.
Thank you, Leslie. Miriam, would you like to add to the discussion?
Sure. Yeah, so diverse funding, I think Leslie was talking about provincial funding, and I fully agree. We have Manitoba funding, which is super helpful in reaching other groups of newcomers. However, it still doesn't reach everybody. So having other diverse funding is also super helpful. Volunteers fill in a huge gap. They can work with anybody, really. So we have volunteers working with a lot of our clients who are not eligible for some of our services. And sometimes, I mean, one thing that's hard to be flexible on is our English classes. So volunteers can help fill that gap a fair bit. We have settlement partners, which is volunteers as well. So we would partner a volunteer with a newcomer, and they can help either with language or, well, language is a part of every part of their meetings together, but also get to know the community and bridge some of those gaps. And hopefully they have some things in common so they can kind of build from there. And volunteer-led conversation circles, we always have that available. It's one of the things we have to do through our IRCC agreement, but because it's volunteer-led, anybody can join, which is super helpful. We have another program, adult literacy classes, which is not IRCC funded, it's through the province. So for some people that are not eligible, or like how they recently cut stage 2 ESL classes, we can now refer them to our adult literacy, which is super helpful. It's a little bit of a different structure, but they're still getting their English and also gaining credits towards high school if that's what they need to do as well. We have diverse funded youth programming. So like right now we have our summer program happening, and that's sponsorship through different businesses and organizations in the community, and multiple funding through the province and the federal government. So that opens up doors to reach ineligible clients as well. We also, I don't know if anybody's heard of it, but we have Ride for Refuge. It's through Blue Sea Foundation. So it's a little bit like, what's the other one called? They do other massive funding, and they support you and train you and help you with all of everything you need for doing the fundraiser. So that gives us a little bit other money that we can use towards our newcomers and whichever ones that are needed. It's mostly geared towards refugees, but often sometimes those are the ones that are also falling through the cracks. So that's also helpful. We have diverse funding for our employment programs. And so anybody who has a barrier to employment, really could fit into any of our programs, which is super helpful, as long as they're permanent residents or Canadians. So sometimes that captures some of the ones that are not getting those services through IRCC funding. We have a food security program as well as ID services. Sometimes some of the services that are really needed, as in question 3, what was talked about when people move from another another city, and now they're no longer eligible for IRCC funding. Sometimes what they need is just help getting those IDs and getting into the community. So that ID service is not IRCC funded, and it's actually for the community at large. And so in that way, they can still get those ID services, even if they're not eligible through IRCC funding. But as a practice, I think it's really important for people to use warm referrals, of course, when they're referring to another organization or even within the same organization. Advocacy and training. So we can't do everything. We can't be everywhere. But newcomers they're working and they're going to different places in the community. So the more the community understands trauma-informed practices, or the more they understand newcomers and diversity, the better the community as a whole can be a support. And that's also advocacy, advocating for those people that need that support. And so that makes us not the everything for them, but building the community as a whole. And I think it's really important to promote faith communities for people that identify as part of those communities, because people that are a part of faith communities, I find that they get more of a wraparound support, a warm support from the community. It's like an automatic part of the community that they can join and feel a part of. So I think as an agency to kind of promote that to our clients who identify as part of those communities, and cross-program flexibility. So especially in small centers, we can't say that's not my job. That's not helpful for anybody to be able to say that. But also thinking that you can do all of it is also not helpful. So referring to the people that you know that are the experts in the topic, or the organizations that know more about that, is also more helpful for everybody, even you as a whole. So yeah, that's all I got.
It was great, Miriam, and thank you for highlighting the importance of that capacity building within the community, so that it's not all on you as a service provider. Adam, do you have anything you want to add to that?
Yeah, so eligibility for I know for federally funded settlement services may end, but I know the newcomers' needs are extensive, and for that, strong local partnerships like that we have are bridging the gaps. The major partnership that we have is with grassroots organizations. We do have a collaboration and agreement with an organization called Open Arms here in Perth. It's a community-based nonprofit organization serving this area, and we did a very good job with for temporary foreign workers and refugee claimants who are not eligible for services directly with us, but through Open Arms, we've been helping them with all the information they need, information orientation services, and even we did furniture donations and food donations, as well as winter drive-bys. We also have a partnership with the small business and community-led nonprofits. The Pembroke area has several local business owners who are also immigrants, and who have established a community organization, a nonprofit, and addressing local needs for temporary foreign workers who are there. So we also partner with them to to help those temporary foreign workers in what they need. So we support this nonprofit that's been established, and through that, we were able to address the needs of those temporary foreign workers. Municipal partnerships, municipalities can support newcomer initiatives through their economic development programs. So we work with almost all of the municipalities in our area to support economic development. So through that, newcomers were able to get jobs or to get different opportunities to support their careers. Volunteer and peer mentorship programs is the other one. Our informal language circles are also run by volunteers. So now everyone, regardless of their statuses, can come and participate. But engaging former newcomers and long-term residents and community volunteers as peer navigators who can provide informal guidance, cultural orientation, and also local connections. The last one is employer collaborations. So we're developing partnerships with employers to provide workplace orientation, retention supports, and language practice opportunities for their employees who are temporary foreign workers still not eligible for our services. But they also do mentorship programs and recognizing, and they do also understand that successful settlement directly contributes to workforce retention. Thank you.
Great. Thank you, Adam. Sasha, did you want to add to that as well? I know that it's
Yeah,
I'll just add a little bit. With our BC settlement funding, it's really for temporary residents and naturalized Canadian citizens. So there's going to be definitely a gap that nobody is supporting those that are no longer eligible PRs because they are not funded. And of course, with funding cuts, we worry that that funding might be reduced. Hopefully not. But that's one side. We are looking for other sources, corporate funding, and other sources of funding, which then would have the full eligibility. Volunteer programs, we have a volunteer management program and looking at it. My worry is really offloading some of the services on people that are already stretched, and cost of living is very high. So some concern. I don't think it's a smooth sailing, and it's wonderful, and it's going to be easy. Our employment service in BC is called Work BC. Their eligibility is very, very tight. So we were one of the, and we still are, except for the limited time for permanent residents. We are a place that can support people when they need it, when they come. So we will have to really figure out ways how we can continue to do that without putting too much pressure on our staff and also volunteers. So finding really those critical areas that people are interested to volunteer and pick up some of the pieces, but how do we appreciate and recognize volunteers, not just take them for granted? And for our funders to see like, oh yeah, no problem, we can change policies like that, and communities will deal with it. So I think it has to be a balanced approach, and because we are in the early days, we are just wait and see and prepare and encourage clients to become independent. And really, that's what we have been doing right from the start. But there are so many challenges that people are dealing with. So I do worry about the future.
Sure. All right. Thank you, Sasha. And our last question is for all four panelists, just before we move to some of the questions that are in the chat. So we'd like to ask all of you, are there particular newcomer groups, for example, women, seniors, youth, Francophone immigrants, that may require different approaches? So maybe Miriam, and then Sasha, Leslie, Adam.
Sure, I'm just thinking about, I think all of those require different approaches from each other. But women in particular, depending on their situation and their own supports within their communities or their households face, I believe, a higher rate of domestic violence or domestic challenges, and can be isolated within their homes as well. So sometimes going to the home to do maybe home visits or speaking to them, giving them a chance to have the children taken care of as you work with them, that can be a different approach for them as maybe another group. Youth have been a bit of a challenge to reach at times because, especially teenage youth, because how do you keep their attention or keep them interested in what you're trying to do with them? So, yeah, definitely requires different approaches for different groups. And sometimes seniors can't get out to your programming. And so being able to reach them is harder.
Thanks, Miriam. Sasha?
Yeah, absolutely. Different groups, again, from the lens of the policy change for eligibility. I think that women, especially those that are starting families and are not able to access services or access them in the different ways, they are going to be really impacted. And youth, they come with their families, and you know, if parents are temporary residents, they spend a long time worrying with their families and reaching out to them. And so that's one of the things that we run summer programs, particularly for youth, and also during the year. Again, growing up in different cultures, home, and they can become very vulnerable. So I would say women and youth are probably the priority for us that we're looking at. And of course, seniors as well. But yeah, I would say women and youth.
Perfect. Thanks, Sasha. Maybe Adam, you can go next. I see Leslie's just stepped away a moment.
Okay. So yeah, I mean the different populations of newcomers experience settlement differently. Therefore, they require tailored support. So in our area, women may face childcare responsibilities that limit participation in language classes or employment programs. Then we need to tailor it based on their needs, the flexible scheduling, childcare supports, or sometimes as well, women-only programming can improve access. Youth often adapt quickly to school, but they may struggle with identity, belonging, or mental health. Then our Swiss program, our school-based settlement services, can support successful integration, and we've been seeing improvements as well. Seniors frequently experience social isolation because they may not be employed or attending school, or we don't have as many seniors to create a group to run supports. So we do have like we design with the help of sponsors or other volunteer community organizations tailored help for seniors. I remember once we were floating an idea of getting a sewing machine for seniors as well. So it goes like that, and people with disabilities may require accessible programming, assistive technologies, maybe laptops at the libraries, and other individualized supports. So yes, absolutely. Particular newcomer groups, they require different approach, and based on that, we were able to support them and address their needs.
Thank you, Adam. Leslie, did you want to weigh in? Final word on this piece?
Well, the only thing I would say is that it'll be quite interesting to watch how the settlement program funding and criteria evolve as the numbers of Francophone immigrants rise, because I believe in last year they represented about 8% of total PRs, and that's going to rise by a couple of percent over the next couple of years. I understand that quite a large proportion of the people being admitted are coming from outside Canada. So the two-step migration model is not applying, and apparently quite large numbers from Francophone or at least partly French-speaking countries in Africa. So I would think that the needs in the immediate transition might be not only different but greater for these groups. Now, there may indeed be some very worthwhile programs and changes that are underway or that are already being put in place, but I haven't heard much about it, and it's maybe an area that Pathways to Prosperity is intending to look at in some of its other work. I don't know.
Great. Thank you, Leslie. And Sasha and Miriam and Adam for all of your thoughtful contributions to these questions. They are in the chat for people who haven't been following that along, and there are some additional questions and many comments in the chat. And so, Natalia, did you want to lead off with maybe one of the first questions? We'll just kind of go through.
Yes. So, given in terms of interest, there was a comment made by Margaret. Hope I'm pronouncing that correctly. As an evaluator, the discussion makes Margaret think about tracking the negative impacts of reduced funding. And so I guess it lines up with a question that a lot of us have had in terms of what indicators should communities monitor to understand the long-term impacts of these policy changes? What should we be keeping track of so that we can, report back to IRCC or other funders about the impacts of these changes? Does anyone have any thoughts on that? Let's start maybe, Sasha, do you have any thoughts on what things people should be tracking?
No, that's a great question, and I have been thinking about it a lot. One thing that's obvious, we keep track of the clients that are no longer eligible. And I think as we were talking about trying to figure out how we connect people in different ways is, what is the cost of using volunteers, right? In some ways, instead of being able to serve the families and individuals as we did in the past. The other thing, I just had a thought. Sorry. Yeah, I think that's a really important question that we should explore especially over as this new policy takes more effect. But I definitely think that the impact of the changes is important, and we want to maintain the, as Leslie's research shows, also the settlement services and the settlement sector in Canada is one of the best in the world, and that's how people get connected and are more productive citizens. And we don't want to lose that, but we don't also want to stretch our organizations beyond its capacity.
Okay. All right, thanks, Sasha. Anyone else want to comment on that?
I think I'll just build on what Sasha said, because I agree with everything, so I don't want to repeat. But I think also paying attention to how it's affecting the community, thinking employers, and especially in small rural communities, you're going to see that even more. We have one employer in town, at least one, who buses people from Winnipeg to our town to do work and then sending them back. And we're saying, we could have people here. But maybe at some point that was out of necessity, and now they're just busing the people that remained with them. So some of those things are going to be impacted, especially as some of our clients can't receive pre-funding or free services. They might have to start paying for services, as somebody mentioned, I believe in the chat, how some people now have to pay for ESL classes. So yeah, there's a lot of that impact, especially at a time when it's very hard to afford our lives as it is. So now it's adding more to people's things that people have to cover and pay for. And very important things in order for them to settle into the community. So
I see a related question in the chat. You bring up language services, Miriam. Rami asks, would IRCC or ESDC, which is their funder, support tailoring loan programs to help fill in the gap for language programs, which would help secure employment for these newcomers? I mean, I don't know if that's ever been broached as a possibility. Anyone, Leslie, you have thoughts on that?
Well, I want to address the proposal itself, which I think is probably worth studying. But one of the points that hasn't been made so far during this event is, and it is an eligibility issue, is the decision that as of this September 2026, language training will only be available up to level 4, Canadian benchmark level 4, which is I would say lower intermediate. It's the same level required for citizenship. And this means that people who need to develop English beyond the early intermediate level in order to qualify for professional admission and so on. These people are going to be less eligible or less likely to develop their English to a higher level. And of course, the hard choices have to be made during a period of expenditure reduction. But I personally feel that this is not a good decision on the part of IRCC, and I actually recommend in my report that it be reversed, and that for the next round of agreements with settlement organizations, that they be allowed to provide services up to level 8. This is a kind of a surprising decision in a way, given the emphasis of the government on Francophone immigration, and given the historical importance that Liberal governments have attached to official language policies and programs. I repeat that money isn't infinite, but it seems to me that when priorities were being set, somehow this one was chosen for reasons that I wasn't able to determine when I was doing my research. And I think some serious public discussion on this is definitely warranted going forward.
Yeah. Thanks, Leslie. And that also lines up with some of the questions and comments that we're seeing in the chat, particularly whether or not, given the impact of the changes, will IRCC be reviewing the policy changes, and how will they be taking feedback on this sort of on these policy changes? I don't know if anyone has any information about that. Typically, when IRCC puts in a program or there is a review process, but these are policy changes as opposed to one of our pilots, so it's a little different. I do have a question here, and Natasha has about 3 questions here, but I think I'll ask the last one. What specific training, tools, referral systems, or internal practices have municipalities, health agencies, community groups, or other mainstream organizations put in place? Anyone think of, I think Sasha or Miriam or Adam, you can talk about what you're seeing in your communities in terms of examples of programming being put in place in response to these changes.
Um, who would like to go first? I can just
Sasha?
quickly jump in and
Yes, go ahead, please.
our municipality hasn't put in they don't fund any programs or they're part of our LIP, so but barely. Yeah, so that's definitely an area that to work on. But I think Adam mentioned that they are working with their municipality.
Adam, you'd like to?
Yes, we do work with the municipalities. Specific. So there was another program that the municipality used to run. It's called if I'm not mistaken, the Rural Economic Development Initiative. The province of Ontario was funding. That program was I can say the cornerstone to get the settlement program here for our communities. We never had settlement. We started last year on April 2025, and the main thing that as we work with the municipality, in this case the county of Lanark, we do have different referral pathways for clients to be in a way to get their permanent residencies or to process into the different pathways for PR. So through that, we work with the rest of the municipal team we have here. So the temporary foreign workers that we're not able to help due to the eligibility reasons, we refer them to the other municipal staffs, and through the READY program or other fundings, other projects that the municipality has, we do help them through that. It goes the same for different health community agencies, refugee claimants with no primary service provider, doctors, family doctors that used to come to us. We still, there's no, I mean, they're not technically eligible for our services, but we do work with community health centers in our areas to get them family doctors as well. So that is also another referral pathway streams that we have to help refugee claimants.
There's just a comment in there, Adam, directed towards you. Magdalena asks, could you repeat the name of the municipality program that you've just mentioned, please? The first one.
Ontario had a rural economic, it's called the READY program, if I'm not mistaken, Rural Economic Development Initiative. I can check again, I can double check, but I think it was the Rural Economic Development Initiative.
Okay.
And it was a pilot program and our Lanark County was one of those communities to get the pilot, and it was through the OINP to get permanent residencies for temporary foreign workers.
Perfect. Thank you. There's a question here from Chemo on a reverse secondary migration. Is there evidence of newcomers and immigrants leaving smaller centers for larger or urban cities? And how is that impacting our communities as well? Miriam.
I think there's definitely people leaving for larger centers. How is it impacting? It's hard to say, but sometimes the ones that leave are the ones that have the higher education, and they're looking to either continue with their education to gain even higher education, or they're bringing expertise with them that they have better opportunities for jobs in larger cities, and it would be helpful in our small city, but it just doesn't quite meet their potential. So there's definitely people leaving for larger cities. Sometimes it's also just bad information, where they think the opportunities are there, but the opportunities they're seeking are actually right here. So unfortunately, sometimes that's the case as well.
Thank you. And Sasha?
I would say we are sort of seeing the opposite. In the last 3-4 years, there's more people staying after they get to permanent residency. there are at the moment job opportunities. So we are seeing more people staying, being able to purchase a home and remain in the community. There's always a lot of migration, especially during the temporary resident year times. Yeah.
Thank you, Sasha.
Okay. I think we have time for one more question. So I'm looking at Mohammed's question. It has 3 votes there. Could you speak to any gendered impacts of these changes? IRCC has been emphasizing GBA plus approach to service delivery, and it'd be interesting to see if this lens has been applied in their decision to restrict eligibility. Would anyone want to speak to that? I think Sasha, I think you mentioned earlier in your, yeah.
I think that would be a great question for a different panel, which we all would like to hear. But just to sort of look at it, I've been thinking about this. We can sort of deal with funding cuts, but the eligibility cuts kind of go in a different place. That I don't think that it. I think it's looking at the service providers and the organizations that are serving permanent residents. We can prioritize who has higher need. And sometimes it takes longer, and that would be good to give us that trust and the responsibility, as opposed to cutting people off at 5 years without sort of the consideration for their needs.
Well, I just want to say thank you to everyone for participating. Thank you to our wonderful panelists, Miriam, Sasha, Adam, Leslie. Thank you so much for your time and expertise. Thank my co-moderator, Carolyn, and for P2P for putting on this wonderful workshop. So thank you, everybody. Have a wonderful afternoon.